All right, Saray standing by now with the health alert today.
May is National Stroke Awareness Month, but doctors at Intermountain Medical Center want you to always remember the signs and symptoms of a stroke all year round.
I just fell off.
But Solo Toala was on the road.
I was driving, and all of a sudden, boom, it went haywire.
Solo had no clue he was at risk.
I work out for like an hour and a half. I ride my bike to work. I'm very healthy.
What he didn't know was his family history. Turns out half a dozen family members either suffered blood clots or a stroke. Lucky for Solo, he wasn't alone. His wife took over the wheel and drove straight to Intermountain Medical Center.
Solo got here within minutes of his stroke symptoms starting.
Taking quick action is critical. 2 million brain cells die every minute of a stroke. Dr. Megan Donohue, medical director of the Comprehensive Stroke Center at Intermountain Medical Center, wants you to remember the signs.
We use the acronym B FAST.
B is for balance. You may feel dizzy or lose your balance. E for eyes, notice any vision change. F is for face. Your face may droop. A is for arm. Limbs can become weak. S for slurred speech. T for time. Notice the time of the stroke and call 911.
If you don't get to the hospital, if you ignore the symptoms or you don't notice them, then you might not be eligible for treatment by the time you get here. You have to be here within 4.5 hours of the symptom onset.
Solo got here in time and qualified for the clot-busting medication, TPA, to reduce permanent damage.
This little spot up here, that's the part that's been permanently affected by the stroke, but it could have been potentially a much bigger area.
But the medication dissolved some of the clot.
It's pretty amazing. Like, I'm very lucky. That little small things ended my life.
But he was in good hands at Intermountain Medical Center.
We're a comprehensive stroke center, which means that we have the most expertise level of dealing with stroke patients. An everyday stroke to cases that come in within the time window, they can get the most advanced treatments here.
Boom. I was in the CAT scan. I was in my room. How they took care of me, man, it was just so awesome. That's scary.
Solo says his silver lining, he's happier now and stops, he says, to quote, smell the roses. Dr. Donohue says prevention is key. Keep your blood pressure, cholesterol, and diet in check. Stop smoking, exercise, and reduce stress. And yeah, Glenn, he is young, so it's surprising that he did suffer a stroke, but it can happen.
But it certainly changed his perspective in life, it sounds like.
It really did change his life. It really did, in a good way.
Yeah. All right. Coming up.